Welcome to the Architecture of Healing, the podcast where healthcare strategy, design, and operations come together to shape environments that support care delivery and healing. I'm your host, Chase Miller. Today, I'm joined by Corey Gaarde, Healthcare Technology Advisory Services Leader at IMEG. Corey is a nationally recognized expert in aligning healthcare technology strategy with operations and facility design, helping health systems make informed decisions in an increasingly complex and digital care environment. In this episode, Corey and I discuss how the thoughtful integration of technology can streamline operations, improve the provider and patient experience, and support long-term adaptability. We'll explore the shifting role of virtual care, the importance of early planning for digital infrastructure, and the value of bridging clinical, operational, and design perspectives. If you're thinking about technology and its impact on the patient and staff experience, this conversation is for you. Let's get into it. Welcome, Corey. Thanks for joining me today.
Thanks, Chase. Appreciate it.
Well, first off, as we kind of jump into things, can you share a little bit about what your current role is and what you've been up to?
Yeah. So my name's Corey. I am a principal at IMEG. So we are a very large healthcare, multidisciplinary engineering. I always like to say healthcare because I work in healthcare, but we do all disciplines of engineering. But my role here is I lead up our healthcare information technology advisory services practice. So it's a little bit different than the traditional technology design, where our passion and focus really focuses on the patient and care team experience and how we leverage technology. Technology is ingrained in our daily lives, from smartphones to smart TVs, smart homes, et cetera. So why not bring that into healthcare? And then how that can inform the design process to, buildings of the future, so that we're, somewhat ready for, what's next as it relates to the technology evolution. So we have fun doing it.
And you and I have known each other for several years now, serving on committees and kind of back and forth on different topics. I don't think I've ever really had the conversation with you. How did you get into healthcare technology? Like, what's that story?
Yeah, so it's interesting. I've literally been in around healthcare my entire life. And I say that tongue-in-cheek joke because my mother is a retired pediatrics nurse. So literally, I was born into healthcare. I actually have a scar on the left side of my eye where I fell off a chalkboard chair in her exam room. And so I've literally been around it my entire life. So I've always had a passion for healthcare. I think growing up as a kid, I wanted to be a fireman. I wanted to be a doctor. And really that I just liked the medical field, and it fascinated me. I went to school for biomedical engineering, and, I thought I wanted to be a doctor, but stupid me realized that engineering is not an easy discipline to go to school for. And I suck at standardized tests. So I did not take the MCATs, but I was really still enamored by healthcare and wanted to do it. So I always wanted to be a doctor, but I always joke that I'm a little bit of a doctor and a nurse by osmosis by being in this industry. But at the time, coming out of college, healthcare information technology was this kind of new field, showing my age a little bit here of just the technology evolution and what was going on there. And it intrigued me. And I had a friend of mine, she worked for a company called Cerner, which was, one of the big electronic medical record back in the day. And she's like, well, why don't you check this out? And I interviewed with them, and, it allowed me to have a role where I was still utilizing my technical aptitude, but in healthcare in a consultative way. And that was kind of my first foray into that. And I had the privilege to work at some pretty large organizations, and one of which was Northwestern Medicine here in Chicago, where I live. And they hired me on, and we did a ton of things as it relates to advancing technology. And one of those projects was also building a 1 million square foot women's and infants hospital, Prentice Women's Hospital in downtown Chicago. And that was kind of my first foray into the kind of this AEC space. And I was like, this is really cool. Like, it's a 1 million square foot building in a healthcare environment, and you get to tour it before patients being seen, going to surgeries. And our role was to making sure that technology was not an issue on day one. And that's been some of my driving, mantras as it relates to how we advance technology, is that it puts a really unique perspective when you work for a healthcare organization and work in an environment of care, and you see what happens when technology doesn't work, because you get a lot of pissed off people and you get a lot of pissed off patients, and it really impacts experience. And so I translate that into, where I've led into this AEC space, that, we have to push the envelope, and we have to making sure that every computer works, every code blue works, how it integrates with mobile communications now with people and AI, and there's just a lot of different layers into it. And it's really the driving factor of kind of how we're trying to position and really change the industry to be thinking differently about technology. So long-winded answer. I've been in healthcare for my entire professional career in a long time and still have a passion for it and still want to advance it. But technology still is somewhat of an afterthought, even though it's in our daily lives. So hopefully that was a little bit of background.
Oh, absolutely. And so with your comment about, making sure every computer works, every code blue works, that's even more of a thought in the forefront now with cyber attacks, ransomware.
Yep.
What is happening when you can't use those devices, and thinking about how you have those emergency preparedness plans.
Yep. Yeah, it is. I could try and translate it into the design world. Every building goes through commissioning, right? From a code perspective, making sure that this is also one of my jokes, that everybody has to go flush the toilets. It's true, because there's construction dust in there, right? I was like, so why would you not want to test everything to making sure that it works, inclusive of every single aspects of technology and computer, that it's safe and secure? And what happens if it goes down? You have generators, right? That if the power goes down, and not unlike your laptop or computer at home, you get those lovely Microsoft reboots. Okay, so what is your process when those things go down? And you have to be thinking about those things as it relates to technology, because it's just the reality of what it is. Not everything's going to be up all the time. And so what are the downtime procedures? If a code cart's not available, you have to go through all those different aspects. And so we try to really ensure and reinforce with activation planners and the design and the operations staff at the hospital that I want it to break, because if that breaks, who's going to call, right? Who are you going to call to be making sure that this stuff works? Because, you're also, at the end of the day, delivering patient care. There's somebody that's sitting in that exam bay or a patient bed that, oh yeah, a nurse or a doctor is coming in to help them, that if that tech doesn't work, it's impacting their delivery care process. And so we have to ensure that they've got the right tools, procedures, backup things, online. And there's a lot of great things that have been evolved over the years, as it relates to data recovery aspects to help with that. But if you don't test it, you don't know. And a lot of times it's the insurance thing is like, well, we got it, but we just don't know if it works type of thing. I was like, okay, what happens when you actually have to utilize it? And you want to make sure it works. Yeah. And so I think we have to be thinking the same exact ways that, again, just as you have to flush every toilet, you have to make sure every door locks and all the stuff that has to go from a code. Technology needs to be a player in that, because it is so ingrained in healthcare's daily life.
So with the technology that you're talking about, you mentioned, that patient in that exam room is reliant on that technology to work. Mm-hmm. So how then does that technology start to then inform better, improved outcomes for that patient and exponentially beyond, the exam room?
Yeah, I think at the end of the day, there's a charter within healthcare is that we want to be as much as informed of our care processes as the care team members that are doing the process on us. So there is a direction to, whether it be a MyChart application, your smartphone, or whatever it is, but you're in control to a certain extent. And then even so, when you come into these exam rooms and these spaces, that the technology is ready for you. So if you think about it from an outcomes perspective, that if you got, I kind of compare it to like an airline situation. You check in on the airport, you get your ticket, you're ready to go to the hotel or to go to the airport. So it's the same type of model that, when you go into an exam or an inpatient, whatever the procedure is, that, your insurance is good, where you're going, where you're headed, what your arrival time is. When you get there, it's a nice, clean process. You're checked in. So from an outcomes perspective, if it's an efficient process, you're not waiting in the waiting room for 45 minutes to an hour. You're not impacting your day. It's much more efficient from the care team process and the delivery, because Corey's coming in and he's checked all the boxes. He's ready to go. I can see do the procedure or whatever the case may be in quicker time. So it improves their throughput and output. And also it eases the burden on the care team process too, that, they're interconnected. They're tied into me as the patient and really can help on this. So there's a myriad of ways that I think technology can help on that. Again, does it always work that way? No. Do things come up? You're sitting in the waiting room for 45 minutes because they're running long. Yeah. But is there ways to maybe send me an alert to say, hey, Dr. Miller is running 15 minutes behind. Here's $5 to go get a coffee at Starbucks. We'll alert you to come back to the waiting room when you're there. So there's things from a a heightened experience perspective that can be done to help with that. But at the end of the day, if it's quicker, if it's faster, if it's more efficient, that's going to impact the bottom line, and everybody's going to be happy. So.
I would absolutely love for my physician to give me $5 for a coffee.
Right.
Like, that'd be fantastic.
Yeah. Yeah.
If I'm waiting an extra half hour, it's only fair.
Yeah, I agree. Depending on how long it takes to get to your doctor's appointment or how long you wait, and I mean, it's time away from your day. I mean,
yeah.
And I think that's why the virtual care and telemedicine was so impactful, obviously because we had to during COVID, but it makes sense. I mean, if I can do things, for the most part, 90% or whatever it is via video call or even take a picture or something like that and send it to them, like, why not? I mean, that just it helps me, and the doctor could be sitting in their home just as I'm sitting at home. So.
Well, and getting to virtual care and telemedicine and kind of segueing back, you mentioned that airline experience. Well, that experience starts so much further before you get to the airport, with booking your ticket. And same in healthcare, you're calling, you're scheduling your appointment, you're going through your insurance, prior authorizations, all of those kinds of things to get to the point of actually leaving your house.
Yeah.
And once you leave your house, you may already be incredibly angry because it took 27 phone calls to organize this simple appointment.
Yep.
And you get there, and it's no matter how beautiful the space is or how ornate the design or how functional it is, you're just not going to have any of it.
Yep.
And so with telemedicine, telehealth, other technology advancements, how do we see that kind of landscape evolving the overall care experience?
Yeah, I'm optimistic that more people will be embracing that level of airline experience. I like to joke that hospitals in the word hospitality. So like we're used to that, right? So why aren't we doing that in healthcare? And I think that there's just this misnomer that the more access or awareness that we give to these apps or these locations and location-enabled services, that they're going to watch us. That's just it's foolish in my opinion, because it's like I've had an experience like there's functionality within Epic, which is a very big EMR called Hello Patient, and to enable that feature set functionality, you have to turn on location services. And I did it just because I think it's cool, and I do it for other things whether I'm coming into a hotel or an airport or whatever it is, just because I kind of like that heightened, hey Corey, you're here type of thing. Well, I pulled into a parking garage for an outpatient surgery. And as soon as I pulled in that parking garage, I said, Corey, welcome to Advocate Healthcare for your outpatient surgery. Do you need assistance? I was like, that's freaking cool. I was like, it's a high touch experience. But not everybody thinks that way. So there is some roadblocks to adopting that. There's also the health tech equity that certain areas and certain geographies of this country, they don't have smartphones, or that they don't want to embrace that level of technology. My mother hates her cell phone. So I'm sure we've got a lot of people out there that same experience. So I think that the appetite is there from an industry perspective. I think that the technology is there. We steal a lot. And I think that that's one of the privileges of working at IMEG, is that I can reach out to my brethren that do a lot of the same stuff in casinos and airlines. And it'd be like, why can't we be doing it in healthcare? Well, the answer is you can. And if anything, it's a heck of a lot safer and stricter than some of these other, hospitality type of environments. So I do think that it's going to get there, but the problem is that we're designing these spaces for 2027, 2028, and we have aspirations and hope that all these people are going to want to be embracing this technology, but that's just not reality. So we have to be designing these spaces for the both instances. Going back to the airline, right? There's still kiosks, there's still people coming in with paper, there's still people coming in with printed off paper from their home, not the printed airline ticket. But they still want to go talk to somebody and check in things. So, it's a great example, but it's still, you have to have that almost that human interaction or plan for the patient population, the visitor population that does not want to embrace this technology experience, for lack of a better words. So 10 years from now, maybe a little bit more ubiquitous, but it's still a real challenge, and it impacts cost, it impacts design, it impacts, to your point, the aesthetics of the building, that, you don't want queuing. Well, guess what? You're probably still going to have some type of queuing, because you're going to might have 10 people, and that one person could clog up the line. I mean, it's the nature of the beast. It always happens. So, there's things that we can, technology is not the roadblock. I mean, at the end of the day, it's people, to be honest with you.
kind of expanding on that, what is the real obstacle there? Like with your experience driving into the parking garage and other organizations that may not be quite to that extreme yet, what's the obstacle to moving that direction?
I think that there's a couple different layers. It's the proven ROI from a budgetary perspective. Be like, yeah, it seems really cool, but where else is this being done, and what are they seeing from the benefit of it? A hard ROI, right? What are my cost savings? Am I making money out of it? I think there's elements that could be the contrary to that. That's the soft ROI. It's a better experience. People are going to be happier, you know. But again, CFOs and all those, the money people are like, well, I don't care about that to a certain extent, even though HCAHPS and the patient experience scores are part of that. I do think at the end of the day, it is still people when it comes down to it. I know that's kind of a very generic answer, but it's the reality of what it is. Right, wrong, or indifferent. I've tried 6 ways from Sunday to try and get my mom to do different things on the level of technology, but she just doesn't want to do it. And there's people of her generation that really embrace that. And I think that's what the reality it is. And I think that there's also some elements of just healthcare in general where it's not like a Disney or like an airport where you are literally going through one entrance and you're going through one exit. That's control. And you TSA checkpoint. Once you hit that TSA, once you go past that point, you're technically in control of of the airport. Healthcare is much different because you want to create these environments of care where it's open, where it's welcoming, it's friendly. But you still want to have eyes and ears on all of them. How are you going to do that without having some type of single point of access or some type of item, whether it be a phone or you're aware of that person in the environment? And I think those are some of the big obstacles. It's just it's still the people aspects, and it's still the notion that you want to create these environments, whether if it's a Starbucks in the lobby or they've got a really great cafe because they brought a new food services, you're probably going to have people visiting that place that aren't coming there to receive care. They just want to go get a cup of coffee or have lunch. And how does that layer into the building owner, which happens to be a healthcare agent, of having eyes and ears and touch points in that experience? So there's it's a good and a bad thing to have. But I think at the end of the day, that technology is not the issue. It still is at the bottom line. It's still people. So.
Yeah. Do you see that spilling over into the staff experience and recruitment retention? How are those types of technologies starting to integrate with how staff are experiencing their healthcare environment as they work?
I'll say that I see a lot of organizations that either have staff who have worked at a previous organization who had a better technological experience. Like, oh God, I had this great widget over here and we don't have it here, and it sucks. You know what I mean? That's real. And that's the challenge in our healthcare market is each organization, a good portion of them might be on Epic, but they're still unique Epic to their environment of care and their community of care. So it's not a ubiquitous experience across organizations. I'll say the other thing too, from a technological perspective, is that there is the challenge / opportunity that as we do get more digital in the patient rooms or enabling care team members to have smart mobile phones, it's that adoption, right? It's a level of change for them of now I have a digital whiteboard that used to be just a marker board in there, right? And so how is that changing my models of care in this environment and leveraging technology? Then going back to the other point, what happens if that goes down? So there is a level of burden and challenge and heightened expectations that we're putting on care team members. It's for the good, but I think it really reinforces that you have to have a really good change management process in place for these buildings and these new facilities and new environments of care. Training is going to be huge. Identifying champions that really think this is cool and it's not that big of a deal, and maybe you get the curmudgeon old doctor like, I won't do it, but then you can get his buddy be like, Chase, this is really cool. Like, check it out. So it is real. I mean, it's 100% there. And I'm a firm believer too, is that, crawl, walk, run on these things. I know it's cliche saying, but just because you're building a brand new hospital, you don't need to do everything day one. I always say that, future proofing is such a misnomer too, because and I'll ask you the question here, Chase, and see if you can answer it correctly. Why do you waterproof things?
Keep the water out.
Yeah. So why would you future-proof things? So you want to make it future resilient.
Keep the future out, right?
Exactly. So yeah, so don't do that. We don't want future. We want a future welcoming, future resilient, future scalable. And so, as you're designing these spaces, is that, think of what the next thing is going to be in the next 5 years. And obviously we don't have a crystal ball, but you can at least just be thinking ahead of of what is potentially coming, so that we do have the environment of care to do whatever we want to do. But we might not do it on day one, but at least we know we have a path and a charter to be able to do that in the future. And I think that's incredibly important. And also that's an attractive thing to the staff, because the more you listen to them, and hey, if you did have something over your other previous organization, cool, we want to build for that now. Would you want to be a champion of that? So there's ways to get staff embraced and excited about these things. But at the end of the day, it still goes back to the making sure that these care team members are trained on it. And I could even make an argument even into the higher med ed spaces, whether it be nursing, doctors, pharmacies, or whatever, is do they have courses on how to use an EMR? How to use a mobile alert that might be coming to their smartphone because they're 2 doors down helping another patient. It's incorporating these levels of their medical training to leverage the technology in a simulated space and whole environment care. So.
Well, and when you think about the training aspect, I mean, that is so important, but you also have more generations than at any point in the workforce.
Yeah.
So you're kind of meeting them where they're at in terms of their education, where you've got folks that have been educated, 30, 40 years ago, and then folks that were educated last week.
Yeah.
And how do you blend that training into this new environment where they're all working simultaneously?
Yeah, it's huge. And I mean, that is a challenge in itself. I mean, I said that there's 8 generations of patients right now. There's 5 generations of care team members, and each one of them could have different experiences. I hate to say it, but my mother probably retired from nursing because of electronic medical record, because of the introduction of what my field does. So it's like, great, I caused the demise of my mom. But it's the reality of what it is. And it's a challenge, and a new nurse coming out versus somebody that's been in the field for 30 years or a doctor that's been in 30 years, it's a way different perspective, because it's the real world. And how do we incorporate that? And then, we're going to be building a brand new medical facility that's going to completely transform your care, because we're going from dual patient rooms to single, or you got to walk a little bit further distance. Like, there's so many different layers that go into that we just need to be cognizant as it relates to not only the technology, but just the general workflow and the operations in the environment. So
with that environment, one maybe buzzword or new technology that seems to be emerging is around this idea of virtual nursing.
Mm-hmm.
It's this technique to be able to leverage both senior staff and junior staff, younger staff, newer into the workforce, bringing them together. Have you seen that begin to take off in your work? Yeah. And how have you seen that kind of become utilized?
Yeah, I think it's a powerful tool if set up right and used right. I think there's so many benefits to take the burden off of the primary care nurse, to allow them to do more, for lack of a better words. And I hope my nurse friends and brethren won't smack me on the head for that one, but really to do their job more efficiently and more effectively, and making sure that they're getting the help where and whenever they need it. There's a tremendous benefit to having, maximizing resources to bringing, not only virtual nurse, but just even virtual interpreters or dietary or pharmacy or, any part of that care team member into that room, so that at the end of the day, the patient's not waiting, the care team member in the room is not waiting. You can be much more efficient. You can maximize resources. You could help with somebody that might be just burnt out on day-to-day, patient care on the floor because they're working 12-hour shifts, that, hey, they could actually do something and be a little bit more comfortable and still providing that level of care, but in a much less strenuous environment. So, and then, just layering in the advancements of this technology. And, AI is continuing to play a really unique and cool role in my perspective as it relates to the camera, again, use my air quotes there, camera technology in the room, to help with fall risks, to help with hand hygiene, to help be more proactive rather than reactive in certain instances, pressure ulcers, to bed placement, all that type of stuff that can go into that can help the nurse or care team members in that space when they might not be there. And there's this just tremendous benefit. And I think that a lot more organizations are seeing that from a telesitter perspective. So you don't have to hire somebody to sit physically in the room. They can be watching it, and the camera could pick up detections that, maybe a naked eye or somebody in there might not pick up. So I think that there's a tremendous benefit just from a patient safety quality perspective, and then ultimately satisfaction onto the staff themselves and the patients themselves.
Yeah, that's really interesting. I was talking to a colleague recently about alarms and monitors that are in the room, and they're just beeping and buzzing and the
Yeah.
noises that are distracting a patient. And I just made this connection as you were talking about the cameras, but how cool would that be if the camera could detect a light and say, "Hey, this is
Yep.
alarming," and alarm the nurse station, as opposed to alarming the patient for with a buzz or a beep that is incessant for several
Yeah.
minutes.
It happens. It's reality. The overall concept, and this is a national patient safety goal, and even monitored by Joint Commission, is alarm and event management and safety. How are organizations handling alarms and events to create a quieter environment of care, but also streamline the care. So as these alarms and events happens, it gets to the right person, right people, right time, that saying. And then, oh yeah, can you leverage a technology that the camera can literally zoom in on a infusion pump or the like and see what the IO is on the screen? And that can happen. And if you think about that, it could be 15 feet away from the footwall, but that's how granular these cameras can get
Yeah.
to actually, or that the lines, crimped or clamped or whatever it is. So there's a
Wow.
lot of unique things that can be done, again, in a virtual way to help say something to the floor nurse, to say, hey, Chase's line's clogged or something like that, and I can see it. I'm watching the patient. You're good, but get down to the hall type of thing. So it's exciting, but that's a change in the industry, right? And that's a thing. Just as we've gone through this electronic medical record boom, we have to have the same emphasis and focus on alarms and events and creating this environment of care and a quiet environment. Because again, as designers, that's easy, but there's the operations aspects to how to process these things. So
Wow. Thinking about all of the technologies that we have, there's so much coming at healthcare organizations every day. Hey, there's this cool new widget over here, or this cool new piece of equipment that we want to buy. What advice might you have to someone who's looking at all of these different cool ideas and care delivery technologies, but they have a finite bucket of resources to invest in them? Is there some sort of mechanism to help facilitate that decision making to drive technological advancement in the care environment in a meaningful way with so much noise coming in every day?
yeah, there's not really a silver bullet per se in this, but I'm always the use cases, the workflows have to be the driver there. Like, what are you trying to accomplish? Obviously there's a problem. It could be an opportunity because we want to introduce this new service line, but really defining what those use cases are and then determining, is this technology the right fit for that? Or is this technology it hits one item and it doesn't do more? I think those are the other elements too, is that, this is the great thing about healthcare technology. There's a ton out there, but there's a lot of pointed solutions. So if you're going to be spending millions of dollars on it and it only does one thing, is that the best investment? Is there another product or another vendor out there that could maybe do one to many? And again, you might not do all the many, but at least you're investing something that is going to be scalable for multiple options. But at the end of the day, having a good committee structure and selfishly a consultant to help drive what those use cases and workflows need to be for that particular instance, and then going to see what the right technology is out there, and then obviously understanding the budgets. Vendors and want to push everything on them. You don't need to buy everything. Just as like if you go buy a car or something like that, you don't need to get all the bells and whistles on it, even though it looks really cool and awesome. But it's like, really, like, I'm probably going to look at get into a truck. Am I ever going to go off-roading? No. Do I want to have something that's four-wheel drive because I live in the snow area? Yeah. But do I need the Super X sport package to go in the, Baja or whatever? No, I don't. So same kind of logic as it relates to healthcare. It's like, that seems really cool, but would we ever utilize that in this particular area? Probably not. So I think that there's definitely aspects of that, but I do feel it starts with the use cases and the workflows and operationally, what are you trying to accomplish and how can you achieve those goals before even, saying, yes, we're going to go, sign that line for this particular vendor.
As we start to wrap up here, thinking about healthcare as a whole and the overall system, if you could take a step back and say, hey, what's one thing of the healthcare industrial complex, if you will, that you could change What would that be?
Jeez. That's a big question. Um, well, I think as a macro sense, I think the insurance structure it needs a complete overhaul. It's at the end of the day, money drives everything, whether we like it or not. And it puts a burden on the healthcare system because they're trying to improve or fix somebody's life. But it still feels there's barriers and roadblocks as it relates to just getting approval for care. And I know this is a hot topic, but just what regulatory aspects, what the government's doing, it's gonna impact our future of care. I mean, we're already seeing the impacts of the Medicaid reductions and hospitals closing. That's scary to think about. I had an incident with my father-in-law where he was going in for open heart surgery, and the day of the surgery, he wasn't approved yet for his procedure. And so, we had to wait till 9 a.m. for Blue Cross Blue Shield to open up, and then finally got approval for it. It's just scary. And so, like, you're already going in for open heart surgery, and it's like, crap, I'm not even approved for it. And I'm sure that there's many other cases like this across the country. And I think that it's a mountain of a hill, if not, Everest, if you will, to fix that. But that's truly impacting of what we do in our lives, right? How would the cost and the budgets of what organizations can do really impacts of how we want to design spaces, whether it be from the architectural perspective, technology, and mechanicals, whatever it is. It's the reality of what it is. And I would love to figure that out because, and I'm not saying, the bucket's endless, Scrooge McDuck type of thing as it relates to the money pit. But, I do feel that there is a significant challenge and opportunity to fix our healthcare to allow us to do better things. And I do feel like a lot of organizations are doing really good things and running it like a business and being able to afford different care models and embrace the latest technologies. I think on the flip side of that, to change healthcare on our world and in the design space, we have to be thinking about technology and the importance role of that and what it can do across the board. You touched a little bit on the cybersecurity aspects of it. And these environments of care are so interconnected these days. It has to be safe and secure. And it has to work together. And if you don't design these spaces thinking about how the technology plays a role in it, you're missing it. You're completely missing it. And more often than not, I've seen, well, the code says this, and it's like, well, great. The code is one thing, that's bare minimum, but what about the impact experience and how we can do that? Because that's ultimately what we're all patients here, of what we want and expect, as well as, guess what? The care team members expect that as well. So I think that's my biggest ask for the change in the industry is think technology as it relates to design, as critical as the architectural process, as the interiors process, those type of things, making sure that's there.
It's really interesting seeing the parallels to what we're designing because you nailed it. I mean, we're not just designing for patients, we're designing for ourselves. I mean, we're patients ourselves.
Yeah.
And so thinking about the space that we want to experience, the healthcare experience we want to have when we interact with our healthcare system and the organizations that we utilize, it really personalizes what we do in a different way.
Mm-hmm.
So quick rapid fire questions here as in our lightning round, so to speak. What would you call one of your favorite healing spaces?
That's a dang good question. Because part of me thinks of like meditation and calm rooms that come to mind. I mean, I like to travel, and so I was at an airport lounge, and it was a quiet room and had one with little sleeping pods in it, and it was an international flight. It was fantastic. I was like, this thing's never going to work, and I thought I was like, oh my God, it's great. Like it's a comfortable environment.
You might be the only person to say somewhere in an airport.
Yeah. But I think as it translates into, the healthcare environment, you want to create a room that is as much like a hotel space as possible. I mean, at the end of the day, nobody wants to be in a hospital bed, right? Nobody wants to be in a room. But if you get a lot of the similar things that you can have at home, like a Hey Alexa or, a good TV experience, you don't get the stupid 14 channels that every hospital gets, right? You can at least just watch things. I think that will help improve the environment and healing spaces. I've seen some really cool pediatric spaces where it's like, God, I wish I was a kid again. Like, this is just a cool environment. And again, you're still in a healthcare environment. But I think that if the room and the spaces are very comfortable, aesthetically pleasing, and at the end of the day, it feels okay to be there. I don't mind, and even if it's waiting for 15, 20 minutes, 40 minutes for an appointment, whatever it is, it's still comfortable to sit in there.
So what inspires you outside of work?
I think my wife inspires me. My dog inspires me because I love my little guy. But I do think that just, having a really good, strong family structure and support structure really inspires me to keep doing what I do. People that understand and appreciate what we do in healthcare, I think really inspires me. And I think the other thing too is just the opportunity out there. There's just so much opportunity as it relates to technology and what we can do in this space. There's a lot of things in our daily lives, whether it be airports or hotels, whatever it is, that I see and get inspired by, or even going like casinos. It's not like I'm a big gambler, but I was like, there's some really cool digital displays that would look awesome at a hospital lobby or something along those lines. So I think that I pick up a lot of things of just the in our daily lives that I'm like, I think we can do this over here. So
yeah, absolutely. There's a really cool new digital display integrated at the Indianapolis Motor Speedway Museum. I would encourage you to check it out. Super cool. You might get inspired.
Yeah. Well, but the problem is it goes back to cost. Like, we can't afford that. So
right. Yeah, exactly. Yeah. Next question here. What is a book that has changed the way you think?
That's a good question. I'm a big movie guy. It sounds really bad, but I don't necessarily read a lot of books. I'm much more of a consumer of articles and podcasts. But I think one of the books that back in the day when I was, just kind of growing in my career, Good to Great. I don't know if you've ever read that one or not. And Built to Last. It just that those concepts really stuck with me. And you've got organizations that weathered through change, and they've lasted. And then you always go back to that Blockbuster model, right? Huge success story, but then it died because it didn't, evolve into what Netflix is, right? And so, I think that those are some of the books that I think of as it relates to even, working here. My daily life is like, what can you be doing to make sure that you are weathering change and adapting accordingly to whatever is going to come down the pike? I mean, obviously we don't know what's next, but you have to be kind of planning for what's next. So I think those are two books that really inspired me. Born to Run was another one too. That's an interesting one of just that the evolution of the running and the challenges of that Native American and I think it was actually a Mexican, weird culture of like barefoot running. Like, it was just like, it's such a fascinating concept, and it's like these ultra marathoners. So I think some of the books that come to mind right away.
And I'll have you dig deep here on this last one, but if you're going to finish this sentence, how would you finish it? The future of healthcare is blank.
Bright. Yeah, I think it still is. I'm always still there remains hope. And healthcare is never going to go away. I do feel that there's hope. Because at the end of the day, we both said it, we're patients, right? I lost my dad last year to cancer, and we should fix that. We have to fix that because it touches everybody. And so, I'm hopeful. So.
Yeah, absolutely. That's so good. Well, thank you so much, Corey, for being on the show today. I appreciate your time here. And I'm going to put a link down in the show notes for a way to connect with Corey on LinkedIn and otherwise. Thanks again, Corey.
Thanks, Chase. Keep up the good work.
Thanks for joining us on The Architecture of Healing. I hope today's conversation brought you fresh insight and inspiration. If you found this episode valuable, make sure to subscribe, download, and give us a review. Want to learn more? Keep the conversation going and head on over to thearchitectureofhealing.com. We've got more great conversations on the way, but until then, keep shaping the future of care through thoughtful strategy, smart operations, and purposeful design.